This talk is about brachial plexus anatomy. It is intended for occupational therapists working with neonates and infants with brachial plexus palsy. It is the second talk in a series of talks about brachial plexus palsy given in the Lorna Ramos course. This course was created by Dr. John Grossman. This talk was initially presented at NYU in 2018. I brought with me a few friends from Miami to help me with this talk. I will introduce them to you one by one. This one is Weary Face. This one is Focus Face. And this one is Happy Face. They are Roman tribunes in the group that I brought in, a mnemonic master, and an inquisitive monkey. So now that you know all my friends, I'd like to start talking to you about brachial plexus anatomy. The first reaction of a significant number of participants in a conference when someone mentions brachial plexus anatomy is to get wary. The second is to take a break and go for an extended bathroom visit that usually lasts until the end of the talk. I beg you not to do so this time. And I promise you that if you can give me 70 minutes of your best concentration, you will learn all there is to know about brachial plexus anatomy required to manage your patients with neonatal brachial plexus palsy. And you will be happy that you did not take that extended bathroom break. I have arranged this talk in 8 important questions. The first question is, what is the brachial plexus? This is a cartoonish representation of a human. You can see the brain, the cerebellum, the brainstem, the spinal cord, the spinal canal nerve bundles. They are called spinal canal nerve bundles because they are bundles of nerve located within the spinal canal and the brachial plexus. From the brachial plexus, we can see 3 types of nerves: motor nerves, innervating the muscles of the upper extremity and the shoulder girdle; sensory nerves that innervate deep structures such as bones; and superficial structures like skin; and sympathetic nerves. Sympathetic nerves innervate many upper extremity structures, including arterial walls, hair cell muscles, and sweat glands. But in addition to arm structures, sympathetic nerves from the brachial plexus also go to the eye, where they innervate the pupillary dilators and the tarsal muscle or muscle of Mueller. So, as you can see, the brachial plexus is a bridge that goes from the spinal canal bundles to the nerves of the upper extremities, thus allowing signal from the nerves of the upper extremities to reach the central nervous system and information from the central nervous system to reach the nerve of the upper extremities. And the The second question is, what is the brachial plexus made of? Although in the initial cartoon I have represented the brachial plexus as a monolithic structure, if we enlarge it, as I have done in this figure, we can see that it is not. The brachial plexus here, isolated, as you can see, is made of bundles of nerve fibers. Cutting through one of these bundles and looking in a microscope, we can see myelinated axons, as I am indicating in this frame, with the arrows, and also myelinated axons, as I am now indicating. In addition, we see endoneurium. The endoneurium wraps individual axons, is made of collagen and vessels. Its action is as a conduit, and it is very thin at the level of the roots. The next structure we can identify is the perineurium. The perineurium surrounds multiple axons forming fascicles. It is made of collagen, elastic fibers, mesothelial cells, and capillaries. The perineurium has a very important action, that is to be the blood-nerve barrier. The last structure we would identify is the epineurium. The epineurium wraps multiple fascicles. It is made of collagen, elastic fibers, fat, and fascia nervosum. Its action is to cushion the nerve from physical trauma, and it ultimately merges with the dura of the central nervous system. The third question I'd like to address is, what are the pre-brachial plexus structures? For this section, I need you to concentrate hard. Here I have reintroduced the enlarged cartoonish representation of the brachial plexus to indicate the pre-brachial plexus structures, which we will define as the spinal cord in green, the spinal canal nerve bundles in purple, and the vertebral bodies. I will start by telling you about the vertebral bodies. This is a view of a cervical vertebra, probably the fifth or the sixth one. This is the spinal canal. The components of the vertebra are the pedicle, the body, the lamina, the spinous process, the transverse process, the transverse foramen, and the articulation facet. Now I have introduced a view of the vertebra from the side and added another vertebra, probably the seventh, to be able to see the intervertebral foramen. The intervertebral foramen is the exit point of the nerve from the spinal canal. The new arrow indicates the transverse process in the lateral view, and the second new arrow indicates the transverse foramen. Through this foramen, we have two types of vessels: the vertebral arteries and veins. The vertebrae stack on top of each other, which I have represented here in an anterior view. Those vertebrae in the neck form the cervical vertebral column, and those in the thorax form the thoracic vertebral column. The vertebrae related to the brachial plexus are C4, C5, C6, C7, and T1. Now that we have talked about the vertebral bodies, I'd like to tell you about the segments of the spinal cord involved in the formation of the brachial plexus. Were we to remove the vertebral bodies as indicated here by the arrows, we would see the spinal cord. The spinal cord is made of virtual segments. I say virtual because the spinal cord lacks segmentation in its external surface. The vertebral segments most often related to the brachial plexus are C5, C6, C7, C8, and T1. If we go to the C5 segment and cut through it, as you can see, and then look at the spinal cord from the top, we will see a structure that resembles the wing of a butterfly surrounded by amber. In it, we would be able to identify the dorsal horn, the ventral horn. Inside the ventral horn, we would find motor neurons with their fibers exiting ventrally to innervate the extrafusal muscle fibers and the intrafusal muscle fibers. The ventral horn motor neurons receive voluntary commands from the brain, specifically from a region in front of the central sulcus, located in the middle of the lateral surface of the brain. The ventral horn motor neurons also receive involuntary influence from the brain, particularly from the corpus striatum, the subthalamic nuclei, from the brainstem, particularly from the red nucleus in the brainstem. And if we turn our attention back to the cervical 5 spinal cord transverse cord again, we can see that there's also a dorsal horn, and we can see that there's also fibers entering it. These fibers represent the proximal axons of the dorsal ganglion neurons. These fibers have 4 destinations. The first destination is the posterior column, where they ascend to reach the brain, connecting in the thalamus, whose fibers travel to an area posterior to the central sulcus in the middle area of the lateral surface of the brain. This region is involved in conscious proprioception. and epicritic sensation. The second destination of the interspinal sensory fibers is the cerebellum. The information brought by these fibers contribute to unconscious proprioception. The third destination of the interspinal sensory fibers is the dorsal horn sensory neurons. To convey pain and temperature information. And the fourth destination of the interspinal sensory fibers is the ventral horn motor neuron. To these neurons, they bring information from the tendons and the muscle spindles. These fibers create a reflex named the myotatic reflex. So now let's go back to the figure of the cervical spine, since we have concluded that segment of the explanation about C5. But instead of cutting at the level of C5 as we previously did, we cut at the level of C6 and look from above. We would see the same structures as we did when looking at C5. Were we to do the same thing at C7, we would see the same things as when we cut through C5. At C8, the same thing. But were we to cut at the level of T1, we would not see the same as we did when we looked at C5, as I will show you in the next frame. What we would see different when cutting through T1 and looking from the top is the same butterfly configuration, but with a small medial horn. This horn houses the sympathetic motor neurons, whose fibers exit the spinal cord in conjunction with the ventral horn motor neurons. This concludes our discussion of the spinal cord, and now I'd like to address the spinal canal nerve bundles. That is, those structures of the nervous system that are inside the spinal canal from the spinal cord to the brachial plexus. The spinal canal nerve bundles have a one-to-one relation and define the spinal cord segments. So the C5 spinal canal nerve bundle correlates with the C5 spinal cord segment. The C6 spinal canal nerve bundle correlates with the C6 spinal cord segment, and so does the 7 spinal canal nerve bundle and the 7 spinal segment. Same goes for the 8th spinal canal bundle and spinal segment, and for T1, spinal canal bundles and spinal segment. Were we to go back to the 5th cervical spinal region and cut through it and then look from above, but not at the spinal cord, but at the spinal canal nerve bundles, we would see a simple structure that consists of rootlets. The posterior ones are called dorsal, and the anterior ones are called ventral. the dorsal rootlets arise from the dorsal root, which consists of bundles of fibers constituted by the proximal axons of the dorsal ganglion neurons, now going to the anterior region. We would also see the ventral rootlets joining to form the ventral root, which, by joining the dorsal root fibers constituted by the distal axons of the dorsal ganglion cells, form the spinal nerve. The spinal nerve exits the spinal canal through the intervertebral foramen, as we have already pointed out. Now I will go back to the panoramic figure to explain to you the constitution of all other spinal canal nerve bundles. Were we to cut at C5 spinal canal nerve bundles, we would see the same as we did when we look at the C5 canal nerve bundles. Were we to cut at C7 intraspinal canal nerve bundles, we would see the same as we did when we cut through this C7 intraspinal canal nerve bundles. Were we to cut through C8 intraspinal canal nerve bundles, we again would see the same as we did when we cut through the C5 spinal canal nerve bundles. But were we to cut at T1 intraspinal canal nerve bundle, we would not see the same thing as we saw when we cut through the C5 intraspinal canal nerve bundle. I will show you in the next frame what we would see. As you can see in this frame, I have cut through T1. If we look from above at the level of the interspinal canal nerve bundles and use spatial stains, we would see sympathetic motor fibers intermingling with general motor fibers in the ventral rootlets and ventral roots. These sympathetic fibers arise from the middle horn of T1 spinal segment and exit with the spinal nerve. The fourth question is, what is the origin of the brachial plexus? To answer this question, I will go back to the spinal nerve. The spinal nerve, as it exits through the intervertebral foramen, divides into the dorsal ramus that goes to innervate the paravertebral muscles and the ventral ramus, which constitute the first component or element of the brachial plexus. The fifth question is, what are the components or elements of the brachial plexus? For this one, I need you to concentrate very hard, because I will introduce to you a statement to serve as a mnemotechnic rule to memorize the components of the brachial plexus. The statement is, victorious Roman tribunes drink cold beer. And in this frame, you can see the statement in a vertical arrangement as single words. I have done this to show you how to use it, which is to use the first letter of each word to remind you of the different components of the brachial plexus. I use the letter V and R from Victorious Roman to remind me of ventral rami. The brachial plexus has a C5 ventral ramus, a C6 ventral ramus, a C7 ventral ramus, a C8 ventral ramus, and a T1 ventral ramus. The next word is tribune. I use the T in this word to remind me of trunks. The C5 and C6 ventral rami join to form the upper trunk. The ventral ramus of C5 continues as the middle trunk, and the ventral rami of C8 and T1 join in to form the lower trunk. As indicated in this frame, there are three trunks. The next word is drink. I use the D in this word to remind me of divisions. The upper trunk divides into an anterior and a posterior division. The middle trunk divides into an anterior and a posterior division, and the lower trunk also divides into an anterior and a posterior division. So there are three anterior divisions and three posterior divisions. Next, I use the C in the word cold to remind me of cords. The anterior division of the upper trunk and the anterior division of the middle trunk join to form the lateral cord. The anterior division of the lower trunk continues by itself forward, becoming the medial cord, and the posterior divisions of the upper, middle, and lateral trunks join in to become the posterior cord. So there are three cords: the lateral, posterior, and medial cords. The next word is beer. I use the B to remind me of branches. The posterior cord divides into the posteromedial branch and the posterolateral branch. The lateral cord divides into the lateromedial branch and the laterolateral branch. And the medial cord divides into the mediolateral branch and the mediomedial branch. The brachial plexus arrangement we have just described corresponds to the classic brachial plexus, but not all plexus have this arrangement. Some brachial plexus called prefixed brachial plexus have a big contribution from the fourth cervical spine segment and none from T1, whereas those called postfixed brachial plexus have a large contribution from T2 and no contribution from C5. Now, and for the rest of this talk, I will go back to using the classic brachial plexus arrangement for all future explanations. The sixth question: what is the regional anatomy of the brachial plexus? Again, will be discussed, as I previously mentioned, using the classical brachial plexus configuration. I will introduce the most significant structure to this frame and point them out to you as I introduce them. The first of this structure is, I will first address the regional anatomy in a coronal plane and then in a sagittal plane. Looking at the coronal plane, the first structure I like to show you is the first rib. Next, I am bringing in the clavicle. The artery I have just introduced corresponds to the brachiocephalic arterial trunk, since we are representing the right brachial plexus. The artery arising from this trunk, traveling in the direction of the extremity, is the subclavian artery, which quickly changes name to the axillary artery. The next structure I am introducing is the vein, called the brachiocephalic venous trunk, that, following the same principle as the neighboring artery as it travels towards the arm, is called the subclavian vein, and later the axillary vein. The next structure I will introduce is the middle scalene muscle. Now the anterior scalene muscle, as you can see, it is inserting in the first rib anterior to the subclavian artery and posterior to the subclavian vein. Now I am introducing the sternocleidomastoid muscle. So with the introduction of this muscle, we have just looked at the coronal plane of the brachial plexus. I will now proceed to look into the sagittal plane of the brachial plexus. We will first look at the mid-brachial plexus region. I am representing the site of the cut by the rectangular pink structure, which I have just introduced. In it, you can see the clavicle, the subclavian vein, the subclavian artery, and the cords represented in yellow, labeled lateral, posterior, and medial, according to their position related to the subclavian artery. If instead of cutting at the level of the divisions, as we have just done, we cut at the level of the rami, the relation among the different structures of the brachial plexus will be quite different. As you can see in this picture, and I will point out in the next few frames. First, we have the clavicle. Then we can see the first rib cut at the anterior and posterior regions, the subclavian vein, the subclavian artery, and the clavicular head of the sternocleidomastoid muscle, the sternal head of the sternocleidomastoid muscle, the anterior scalene, and the medial scalene muscle. The brachial plexus is sandwiched between the medial and the anterior scalene muscles. In the ventral plexus, we can see the ventral rami of C5, C6, C7, C8, and T1. The seventh question is, what is the irrigation of the brachial plexus? Again, I will describe the irrigation of the right brachial plexus. Hence, I have indicated the brachiocephalic trunk, which, as you know, continues towards the extremity initially as a subclavian artery and then as the axillary artery. I have now introduced the common carotid artery, the vertebral artery, the thyroid trunk, from which three vessels that irrigate the brachial plexus arise. The first one is the inferior thyroidal artery. The second is the transverse cervical artery. And the third one, the supraclavicular artery. The superior intercostal artery arising from the subclavian artery also contributes to the irrigation of the brachial plexus. Question 8 is the last question, but it has a long answer. The question is, what are the nerves that arise from the brachial plexus and what do they innervate? This one, as I just mentioned to you, is the big one, so I need you to concentrate extra hard for it. As I previously mentioned, I will use the classical brachial plexus formation to explain the nerve that arise from the brachial plexus and the muscle they innervate. The nerves arising from the brachial plexus can be divided in three groups according to the region from which they originate. A good system is to use the chords as the landmark to divide the brachial plexus region, as I am showing you in this frame. The region of the chord is then named the middle region. Rostral to it is the proximal region, and distal to the middle chord region is the distal region. I will start by talking about nerves that arise from the proximal region. 6 nerves arise from the proximal region. I will introduce them to you one by one. The first one, arising from the ventral ramus of T1, is called the sympathetic chain. The sympathetic chain is formed by myelinated fibers from neurons in the middle horn of T1 spinal cord segment and end up in one or 3 ganglia. The closest of the 3 ganglia they terminate is the inferior cervical ganglion. The next in proximity, which is a bit further and going in the opposite direction, is the 5th cervical ganglion. From these 2 ganglia, sympathetic neurons produce unmyelinated axons that provide sympathetic innervation to the upper extremity. The 3rd ganglion reached by the sympathetic chain is the superior cervical ganglion. This ganglion houses sympathetic neurons that send unmyelinated fibers to innervate the eye. The second nerve arising from the brachial plexus does so from the ventral ramus of C5. This nerve joins C3 and C4 fibers to form the phrenic nerve. The third nerve, arising from the proximal region, does so from the ventral rami of C5, C6, and C7. This nerve is the long thoracic nerve. This nerve innervates the serratus anterior muscle. I remember the muscle this nerve innervates by remembering the word salt. Each letter in salt can be used to remember the nerve muscles correlate. The S stands for serratus, the A for anterior, the L for lung, and the T for thoracic. The serratus anterior muscle is a very peculiar muscle, and its action is very much based on the way the serratus anterior grabs the rim of the vertebral border of the scapula, despite that it arrives to it from below. This muscle has three actions. The first action is protraction of the scapula. The second action is upward rotation of the scapula. The third action is stabilization of the scapula. The fourth nerve arising from the proximal region of the brachial plexus does so from the ventral ramus of C5. The nerve is called the dorsal scapular nerve. This nerve supplies the major and minor rhomboids. They have two actions. The first action is retraction of the scapula. The second action is downward rotation of the scapula. I think of the rhomboids as the twin enemy of the serratus anterior. They both help keeping the scapula in place by pulling in opposite directions. The fifth nerve, arising from the proximal region, arises from the upper trunk, usually shortly after the ventral rami of C5 and C6 join in. This nerve is called the subclavian nerve. It innervates the subclavian muscle. This muscle, as expected, receives fibers from C5 and C6, and it has one action: clavicular stabilization. The sixth and last nerve from the proximal region also arises from the upper trunk. It is called the suprascapular nerve. It innervates two muscles, the supraspinatus and the infraspinatus. The supraspinatus is a relatively small muscle. It receives innervation from C5 and C6 spinal segments, and it has only one but very important action. The action consists of the arm being in a neutral position. It abducts the shoulder, but it only does so for the first 10 degrees. The second muscle innervated by the suprascapular nerve is the infraspinatus. The infraspinatus is a much larger muscle. It is innervated by fibers from C5 and C6 spinal segments. The infraspinatus has two actions. The first action from the arm by the side of the body in neutral position, it extends the shoulder. The second action can be appreciated with the arm adducted and the elbow flexed, with the hand preferably in neutral position as indicated by the green arrow in this view, or in this look from above, which in this frame I have enlarged and changed the angle in order to show you rotation movements of the shoulder. From the position in this figure, the inferior spinatus produces external rotation of the shoulder. So we have looked at nerves belonging to the first group arising from the proximal region of the brachial plexus. And since now we know them, I will start with those arising from the middle region now. 7 nerves arise from the middle region. 5 of them are considered motor nerves and 2 sensory nerves. The first of these 7 nerves arises from the lateral cord, and it is called the lateral pectoral nerve. The second one arises from the medial cord, and it is called the medial pectoral nerve. These nerves supply the pectoralis major. The pectoralis major is innervated by fibers arising from C5 spinal segment all the way to T1. The pectoralis muscle has 4 actions. The first action from shoulder abduction, shoulder adduction. The second action from arm by the side in neutral position, shoulder flexion. The third action from the arm flexed, shoulder extension. And the fourth action from arm adducted, elbow flexed, and forearm forward position as indicated in this frame, shoulder internal rotation. The medial pectoral nerve, in addition to contributing to the innervation of the pectoralis major, by itself innervates the pectoralis minor. This muscle receives fibers from C8 and T1 spinal segments, and it has 3 actions. The first action is scapular protraction. The second action is downward rotation of the scapula, an action shared with the rhomboids. And the third action is scapula depression, an action shared with the lower segment of the trapezius. The third nerve arising from the middle region of the brachial plexus does so from the posterior cord. This nerve is called the upper scapular nerve. The fourth nerve I will mention to you arising from the middle region of the brachial plexus also does so from the posterior cord, and it is called the lower scapular nerve. These nerves, the upper and the lower scapular nerves, combine to innervate the Subscapularis muscle. This muscle, despite being innervated by two nerves, only receives fiber from C5 and C6 spinal cord segments. This muscle has two actions. The first action from the shoulder abduction position produces shoulder adduction. The second action from arm abducted, elbow flexed, and arm forward position, internal rotation of the shoulder. In addition to contributing to the innervation of the subscapularis muscle, the lower subscapular nerve also supplies the teres major. The teres major is a cylindrical muscle that goes from the lower border of the scapula to the anterior surface of the humerus. It receives innervation from C5 and C6 spinal segments. The teres major has three actions. The first action from the shoulder abducted position, shoulder adduction. The second function of the teres major is from the shoulder flexion position, shoulder extension to neutral position. The third action from arm abducted, elbow flex, and forearm forward position, internal rotation. The fifth nerve arising from the middle brachial plexus region does so from the posterior cord and is called the thoracodorsal nerve, though judged by its location between the upper and lower subscapular nerve should have been called the middle scapular nerve. But it was not so. So the thoracodorsal nerve innervates the Latissimus dorsi, a muscle often referred to in Pig Latin as arrasca ani for reasons you will soon be made aware of. This muscle receives fibers from C6, C7, and C8 spinal segments. The Latissimus dorsi has three actions, from which it derives its Pig Latin name. The first action from shoulder abduction position, shoulder adduction. The second action from shoulder flexion position, shoulder extension to the neutral position, an action shared with the pectoralis major and many other muscles, but in addition, it produces extension beyond the neutral position, an action rather unique to this muscle. That is the one, more than any other, function that has earned it its Latin Pig name of arrasca ani. And the third action of the Latissimus dorsi is from arm abducted, elbow flex and forearm forward extended position, internal rotation of the shoulder. The sixth nerve that arises from the middle region does so from the medial cord. This nerve is called the medial sensory nerve of the arm. The seventh nerve, arising from the middle region, also arises from the middle cord, and it is called the medial sensory nerve of the forearm. So now we have gone through the nerve arising from the proximal region of the brachial plexus and the middle region of the brachial plexus. And we are about halfway through the talk, maybe a little bit more, but still we have a long way to go. So now we are going to address the distal region of the brachial plexus. The distal region gives rise to 5 nerves. The first nerve arises from the posterolateral branch. The posterolateral branch of the posterior cord becomes the axillary nerve. The axillary nerve innervates 2 muscles, the deltoids and the teres minor. Let's first talk about the deltoids. Notice that deltoids have an S at the end of the word. I guess the reason for this S is that there are 3 deltoids: the anterior deltoid, the middle deltoid, and the posterior deltoid. Each of these nerves has a specific and different actions. The anterior deltoid is innervated by fibers arising from C5 and C6. It has 3 actions. The first action is from arm abducted, elbow flex, and forearm extended position, internal rotation. The second action from shoulder horizontal abducted position, shoulder horizontal abduction. The third action from neutral arm position, shoulder flexion. The middle deltoid receive innervation from C5 and C6 spinal segments. It only has one action. From the arm being 10-degree abducted, the middle deltoid further abducts the arm from 11-degree to about 90-degree. The posterior deltoid is innervated by C5 and C6 spinal cord fibers. It has 3 actions. The first action is from arm adducted, elbow flex, and forearm forward position as indicated in this frame, external shoulder rotation. The second action from shoulder horizontal abducted position, contraction of the posterior deltoid swings the arm outwards. That is, it causes horizontal abduction. as I have represented in this frame. And a third action from shoulder flexion position, shoulder extension. So that is a story with the deltoid, one of the muscles innervated by the axillary nerve. I will now talk about the other muscle innervated by the axillary nerve, which is the teres minor. The teres minor is innervated by fibers from C5 and C6 spinal segments. The teres minor has two actions. The first one is from arm abducted, elbow flex, and forearm forward position, external shoulder rotation. The second action from shoulder flex position, shoulder extension. The second nerve arising from the distal region of the brachial plexus arises from the posterior medial branch of the posterior cord. This branch becomes the radial nerve. I am bringing the mnemonic master to tell you a tip to remember the muscles innervated by the radial nerve. And that tip is the radial nerve keeps tabs on the extensors, implying that all nerves in the arm that have the word extensor are innervated by the radial nerve. The key word here is tabs. Tabs stand for triceps, the T, the A for anconeus, and also for the abductor pollicis longus, the B for brachioradialis, and S for supinator. These 5 muscles are the only ones that are innervated by the radial nerve that do not have the word extensor in their names. All other muscles innervated by the radial nerve start with the letter E. I will now make a few comments about radial nerve innervated muscles. I will start first with the triceps. The triceps receive fibers from C6, C7, and C8 spinal segments. It has two actions. The first one from shoulder flexed position, shoulder extension. The second action from elbow flex position, elbow extension. Next, we will address the anconeus. The anconeus is a small muscle. It receives fibers from C7 and C8. The anconeus only has one action. From elbow flexion position, elbow extension. Next, we will address the abductor pollicis longus. The abductor pollicis longus receives fibers from C7 and C8 spinal segments, and it has two functions. The first function is to go from thumb adduction to abduction of the first metacarpal at the carpo-metacarpal joint. Its second function is wrist abduction. Next, we will address the brachial radialis. The brachial radialis receives fibers from C5 and C6 spinal segments. It has one action: from elbow extension in neutral position, elbow flexion. I call this action the sucking thumb motion because it's the action required by infants and children to suck their thumb. Next, we will address the supinator. The supinator muscle receives fibers from C5, C6, and C7 spinal segments. The supinator has one action: to supinate. The supinator supinates better when the arm is pronated and extended at the elbow than when the arm is pronated but flexed at the elbow. Now that we have considered the TAPS muscle of the radial nerve, I will now briefly talk about those radial nerve innervated muscles with the word extensor in their name that are significant to the understanding of neonatal brachial plexus palsies. I will first address the extensor carpi muscles. The extensor carpi muscles are constituted by three muscles: the extensor carpi radialis longus, which receive fiber from C6 and C7 and has two actions. The first action is wrist extension. The second action is abduction or radial deviation of the wrist. The second extensor carpi is the extensor carpi radialis brevis, which receive innervation from C6 and C7 spinal cord segments. The extensor carpi radialis brevis has one action: wrist extension. The last of the extensor carpi muscle is the extensor carpi ulnaris. The extensor carpi ulnaris receive innervation from C6, C7, and C8 spinal segments. The extensor carpi ulnaris has two actions. The first action is wrist extension. The second action is wrist adduction or hand ulnar deviation. The third nerve arising from the distal region of the brachial plexus does so from the lateral branch of the lateral cord. It is the musculocutaneous nerve. I remember the muscles innervated by this nerve by thinking of the British comedian Benny Hill, who used to work for the British Broadcasting Services. The mnemonic is BBC. The first B stands for biceps, the second B for brachialis, and the C for coracobrachialis. I will now address the biceps. The biceps is innervated by fibers arising from C5 and C6 spinal segments. The bicep has three actions. The first action can be assessed starting from the elbow extended in supinated position and consists of elbow flexion when the arm is as it is presented in this frame in supination. I call this action the feet cookie motion to distinguish it from the thumb sucking motion best achieved by contraction of the brachioradialis. The second action is supination. The biceps supinates better when the elbow is flexed than when the elbow is extended. In this regard, it is the opposite to the preference of the supinator, which works better when the elbow is extended. The third action of the biceps consists from shoulder in neutral position, shoulder flexion. The second muscle innervated by the musculocutaneous nerve is the brachialis. This is an interesting muscle that at times is innervated by the radial nerve and at times by both the musculocutaneous nerve and the radial nerve, whereas other time it is innervated by the median nerve, but most of the time it is innervated by the musculocutaneous nerve. That is the reason why we are talking about it in this section. The brachialis receives innervation from C5 and C6, and it has one action: elbow flexion without any regard to the position of the arm. When the arm is supinated, elbow flexion. When the arm is in neutral position, elbow flexion. The third muscle innervated by the musculocutaneous nerve is the coracobrachialis. The coracobrachialis is innervated by fibers from C5 and C6 spinal cord segments. The coracobrachialis has two actions. The first action from shoulder neutral position, shoulder flexion. The second action from shoulder abducted position, shoulder adduction. The fourth nerve arising from the distal brachial plexus arises from the union of the lateromedial branch of the lateral cord and the medial-lateral branch of the medial cord, and its name is the median nerve. The median nerve innervates forearm and hand muscles. I will first tell you about the forearm muscles it innervates. The median nerve innervates all anterior forearm muscles except two: the flexor carpi ulnari and the flexor digitorum profundus to the fourth and the fifth fingers. The median nerve innervates three forearm muscles that have great impact in the posture of the most common type of brachial plexus palsy that presents in neonates. Those I will address them here. These three nerves are the pronator teres, the flexor carpi radialis, and the pronator quadratus. I will start talking to you about the pronator teres. The pronator teres is innervated by fibers from C6 and C7 spinal segments. The pronator teres has two actions. The first action is pronation of the forearm. This action is only achieved by this muscle when the elbow is extended. The second action is elbow flexion. The second median innervated muscle I will mention to you is the flexor carpi radialis. The flexor carpi radialis is innervated by fibers arising from C6 and C7 spinal cord segments. The flexor carpi radialis has two actions: wrist flexion, and the second action, hand radial deviation or wrist abduction. The last median nerve forearm muscle I will mention to you is the pronatus quadratus. The pronatus quadratus receives innervation from C8 and T1. The pronatus quadratus has one action: pronation, that is achieved when the elbow is either flexed or extended. Having talked to you about the median nerve innervated muscles of the forearm, I'd like to make a brief comment about median nerve innervated hand muscles and about their relation with the sensory innervation of the same region. All hand median innervated muscles, the lumbricals for the second and third fingers, the opponent pollicis, the abductor pollicis brevis, and the superficial head of the flexor pollicis brevis, which I have colored solid blue in this figure, are innervated from C8 and T1 spinal cord segments, and as such join the median nerve through the mediolateral branch of the medial cord. What makes hand innervation interesting is that the skin just above this C8 and T1 spinal cord innervated muscle is innervated by fibers joining the median nerve through the lateral medial branch of the lateral cord arising from C5 and C6 spinal cord segments. The fifth nerve arising from the distal brachial plexus is the ulnar nerve. The ulnar nerve is the quintessential nerve of the intrinsic hand muscle. Yet in this talk I will only mention one of the ulnar innervated muscle, and this one is going to be in the forearm. This muscle is the flexor carpi ulnaris. The flexor carpi ulnaris is innervated by C8 and T1 spinal cord segments. The flexor carpi ulnaris has two actions. The first action is wrist flexion. The second action is hand ulnar derivation or wrist adduction. With these comments about the flexor carpi ulnaris, we will end our discussion regarding the nerves arising from the distal region of the brachial plexus and the muscles they innervate. This also will be the conclusion of our discussion specifically about anatomy of the brachial plexus, but further comments about nerve action will be presented in the talk about clinical presentations of brachial plexus palsy in neonates that will be placed in YouTube shortly. Well, I hope you have enjoyed this talk and you have all earned your diploma with flying colors. Thank you.